Well, first thing that when a client does, obviously we want you to go on the website and look at us and, watch these videos and try to find out, who's a good fit. But, once you make the call, you're going to talk to Christy, who is really great, and she's going to help you figure out, if you need to be with me or with, somebody else and what you really need, or if we are not going to be able to help you. But, Christy's really great and just will walk you through some of those things. So the first thing is, to get, a copy of the consent form, which Christy would send to you. So you really understand and you can take some time to read through just some of the housekeeping and business type of stuff related to working with each of us. And then usually there's a biographical form that we ask people to fill out. And this is just kind of a quick snapshot of who you are and a little bit of your history. But I think, for me, one of the important things when someone's coming into session is for them to have some general idea. They don't have to know it all because that's what they're going to be doing in therapy, but just some general idea of how would they describe their current struggles, or how would somebody else, if their spouse were here or their adult child were here, what would they say you're struggling with? And, to maybe put some thought into how you would word that, because sometimes it's so up in our head, we don't know the words that we would use to describe our struggles. And then, just from another housekeeping standpoint, I always want to know, what health conditions do you have? What medications are you on? What doctors are you seeing and how often? Because especially for the people I work with chronic illness, the medications could play a large role, or if you've got sleep apnea and it's not treated, that can play a large role in depression and things like that. So, I always want to know those things, and then I'll, do the work kind of behind the scenes to figure out, is there something we need to pay attention to? Do you need to manage this med different? Is there an interaction effect here that we need to pay attention to? So those are just kind of the basic things for me. The only other thing I would say is, if there's someone in mind that you want to be kept in the loop about treatment, whether it's your psychiatrist, your physician, your pastor, somebody in your family or a friend, somebody who can also help support you, do you want me just to, send some quick faxes to and say, this is what we're doing, like very basic information sharing. So those are the type of things I think to prepare.
I think the thing that they need to kind of understand is that first session isn't going to be therapy, probably. It's just going to be getting the business stuff out of the way, taking a picture, a copy of your driver's license, your insurance card, so forth, and just getting that stuff out of the way, finding out, well, what brought you here, and doing that sort of thing. So to come in the first session and expect therapy, probably not going to happen.
Yeah, good point.